A potentially huge breakthrough in the fight against the H1N1 virus. A new report shows one dose of vaccine may be all you need to protect yourself this flu season. Our senior health and medical editor, Dr. Richard Besser, is here to explain it all to us. So what is the study? What did it find?
This is very exciting news. The New England Journal yesterday released results of the first trial of the swine flu vaccine in adults. Came out of Australia, and what they found was one dose of vaccine was enough to give protective immunity. Very surprising. All along, we've been planning on 2 doses of vaccine. Logistically, in terms of expense, 2 doses is much more complicated. People don't like shots. Going to 1 dose is going to really dramatically increase the number of people who can get vaccine and people's willingness to get vaccinated.
And reduce costs in the meantime.
That's right.
The U.S. study is coming out today, right?
I spoke to Dr. Tony Fauci last night at the NIH. He's head of infectious diseases. And this afternoon, he's going to release the results of the U.S. studies, and he said they showed the exact same thing. And
it also seems that the vaccine kicks in a lot sooner than previously thought?
Well, that's what he's saying. The Australian study didn't look at that, but the U.S. study is saying that in 8 to 10 days after getting the vaccine, people should be protected. That's very fast for a vaccine.
You said adults. What about children? I know the study really geared toward adults.
That's right. You know, this study just looked at healthy adults. The results from children should be out in about 2 weeks. What we expect to see, or what we've seen with other flu vaccines, is that older children, children 8 and above, tend to respond like adults. Children below that may need a second dose. We'll just have to see.
Okay, so remind us again, those who really should be getting the vaccine once it's available.
Okay, so those who are in the highest risk groups include pregnant women, children from 6 months to 24 years of age, those adults with chronic underlying medical conditions, emergency medical workers and healthcare workers, and those people who are caring for very young children, because the very young, those 6 months and under, can't get the vaccine.
And so overall, Dr. Besser, because we've been talking about this a great deal, to have this kind of news, to know what's coming out with the study with the U.S., because, you know, we're really about to hit flu season right now.
We're in flu season. Flu season is around us. The seasonal flu vaccine is here. People should get that vaccine. And when the swine flu vaccine comes, if you're in one of those groups, you should get in line and get that vaccine.
And it looks like the target date will be October 14th, that the vaccine will be available?
Still targeting the middle of October, and everything I heard from the CDC yesterday is we're on track.
Okay, and 1 dose, that's huge.
That's great.
Dr. Besser, thanks so much.